Thanks very much, Norbert, and thank you, colleagues and people on this webinar. You are our colleagues. I am the former CEO of ECRI. I'm currently the president emeritus and am an adjunct senior fellow at the Lerner Institute of Health Economics at the University of Pennsylvania. And I'm in the Keystone State. We've been the Keystone State, Pennsylvania, for a long time, and we are again. I want to talk about practical tools for how we should operate going forward to the midterms and then after that. So the first step is to look at the title of my talk, this brief talk. It's called Look for the Hook, because that's what we need to do. We need to recruit people to help us, healthcare professionals. It's often been doctors and nurses, and that's useful now over the summer, but we need to be ready to go by Labor Day with op-ed pieces in more traditional media in Pennsylvania. Now, Norbert and I have done this, and very successfully. Here's what our strategy has been. We've crafted op-ed pieces with titles like Health Professionals as Diplomats in the COVID Culture Wars. Now, this was when COVID was the top issue that we were focusing on for a few years. And it was a hook that worked with the editorial boards of news media like the Philadelphia Inquirer, where many doctors and nurses pass through Philadelphia. So that it's useful to talk about this in our hometown because of that, not because we would recruit Republicans. After all, Philadelphia is a Democratic city. But then we went to other counties in Pennsylvania, and we went to the swing counties. So we published in newspapers like the Wilkes-Barre Times Leader, which was Joe Biden's hometown. And we published in Altoona, and we plan to publish for the midterms in Pittsburgh. Now, what did we do? When I say look for the hook, what I really mean is two kinds of things. You have to have content. In other words, what issues are you going to focus? And you do want to often begin a piece with a personal experience, especially if you're a health professional. People relate to that, and traditional media relates to that. But you also have to use phrasing that's going to get a person to read the next sentence. And that's why we, chose during the COVID period to emphasize the COVID culture wars, and we used the phrase that we needed a political vaccine, not just a biological vaccine. It turned out to be effective. We got published. So the issues are, what do you want to emphasize now? Now, you have some very interesting ones, because obviously there's abortion and gun control, which have already been discussed. And the interesting fact there is that when you look at the percentage of the vote in Kansas, it means Republicans voted. They were swing voters on this issue. And it's the swing voters we want. But we need to go beyond the issues of abortion and gun control, as effective as they are, figure out how to use them. Because look at these other issues. Drug pricing, big issue here. Pennsylvania has an older population. They care about Medicare and drug pricing. Those of you who can remember what it was like to fly and have an in-flight magazine may remember the Chester Karras ads that used to appear in those flight magazines, those in-flight magazines. His catchphrase, his hook was, you don't get what you deserve, you get what you negotiate. And we need price negotiation in Medicare if we're really going to bring down prices. So that's a good issue in an older state, and frankly, pretty much anywhere. But there are other issues you can look at: mental health parity and substance abuse. And we'll see where COVID goes. It looks like a worn and weary issue right now, but it may not be by September. But the question is, how will you phrase it? How can you bring in your personal experience and then get that literary hook, whether it's alliteration you use or metaphors that can stay in a person's mind? But that's the goal. We've been successful. We need to be successful for all of the reasons the previous speakers have emphasized, and for all of the reasons you already know, or you wouldn't be on this webinar.
Thanks so much.